I don't know if we have it back yet.
It's right there.
Oh, yeah, thank you. Yeah.
Okay, so I will call our Ramsey County Board workshop to order today. Today's topic is the county's community indicators. Just a courtesy reminder that this board workshop is recorded and live streamed on the Zoom webinar. There will be no votes taken during this workshop. So let's start off with introduction of the commissioners and presenters around the table and then to the rest of the room. I will begin. I am Ramsey County Commissioner Mai Chan Shang. I represent District 6. I will be chairing this workshop.
Kelly Miller, Ramsey County Commissioner, and I represent District 7.
Hi, I'm Lindsay Menard. I'm a senior policy analyst, and I just started in January, so today is my first workshop.
I'm Larry Timmerman, Planning Manager and Policy and Planning.
Dave Zaffron, Senior Policy Analyst in Policy and Planning.
Lynn Becker, County Manager.
Rita Moran, Commissioner District 4.
Mary Jo McGuire, Commissioner District 2.
Tara Bevan Singh, Commissioner District 1.
I'll go to the side there.
Julie Wood, Government Relations. Hi, Jennifer Aurora, Government Relations. Good afternoon, my name is Dila, City Commissioner of Merchant.
Your adjunct deputy county manager, Health and Wellness Services.
Ray Schneider, to the staff.
Casey Lane, Chief Clerk.
Patients, City General.
Wonderful. I will then pivot us to about today's workshop. It's to focus on the county's community indicators. It is also available online for folks who are interested. It measures our community-wide outcomes, track trends in overall community health.
Our community indicators program. What are community indicators? Our connection to strategic planning, the budget process and performance measurement. We'll walk through the indicators. About half of our current community indicators will be presenting today. Where to find the community indicators on the open data portal, and this will be the last time I say this, but they are all up and ready for you to take a look at. In addition to that, so are our performance measures, and if you go to our strategic priorities, you'll also find performance measures tied to them. And so it's been a very busy summer, and we're excited to be able to let you know all of that is ready for you to view. And then next steps, we'll talk a little bit about what we're doing next with our community indicators as well. So our first slide is a collage of photos from around the community that was our communications and public relations department put together. Community indicators help us to inform our long-term direction and our strategic planning. And so these are not things that we can do alone. So these community indicators are bigger than county services. And what you see here in this collage of photos is people interacting, some of them with county staff, some without, or with others. You see healthcare settings, you see nonprofits, you see people recreating. All of these things are part of the community indicators that we'll be presenting today. And so just by way of back the indicators, affordability, wealth, early childhood, health, and public safety, all of which you can see would have a role to play in the upward mobility of families across the community. So in this year, as we thought about what do we need to do, or what can we do to improve our current set of indicators? We have, from the origin, had some of our indicators that had data sources where we knew there would have to be updates. We may need to find better sourcing. And some of that could require tweaking the community indicators. And a big driver of that was disaggregating our data sets. And so we're really pleased that we've been able to do that with most. The Urban Institute, for instance, doesn't include Asian in most of its data sets. And so that's come out as we've talked about our community indicators in prior years. We've fixed that in all but one, I believe, at this point, and continue to look for data sources that'll make sure that we can do that for all of them. We're looking to represent longer term community-wide changes. So as we started with this new set in 2020 and moving forward, 2021 was the first year where they rolled out. We want to keep mostly the same indicators so we can show progress over time. We also want to make sure that we can do just that, go back and look forward, make sure that what we're looking at is both disaggregated and meaningful. So we'll continue to make adjustments as needed. You'll see some of that in the language, and so we're working on 2 or 3 of them all the time concurrently, and then we're highlighting where we're at each interval through the process. So it's a 2-year cycle. And then we'll launch our supplemental budget kickoff in February of 2026. What's not on, and right before that, the strategic plan in January. So you can see where we're going as we work through the strategic planning. You'll hear more updates on that through the fall and into the winter. The supplemental budget will kick off, and that's when we'll come back to work. With that, I will turn it over to Dave Zaffron, who did not acknowledge, but he is also new to policy and planning, at least not new to Ramsey County, but this year.
Thanks,
Thank you,
Larry.
Dave.
So we currently have a total of 14 community indicators in the 5 categories that Larry mentioned: affordability, wealth creation, early childhood, health, and public safety. And today we're going to look at 8 out of those 14. Indicators are disaggregated by race and ethnicity to the extent available from the data source. 12 out of the 14 are disaggregated, while 2 are not. And different data sources use different groupings and labels for race and ethnicity, so you are going to see some slight variation from indicator to indicator in that sense. So the first category is affordability.
Oh, just a minute there.
Yes.
Commissioner Jevonsing.
Yeah, I just had a quick question, which is, are the indicators that within these 5 areas, there are specific indicators that have been picked? Are these a sample of all the indicators we're following, or are these specifically the indicators that we have chosen over time to represent that theme?
Yeah, all of the indicators are updated and all of that data is up on the open data portal. We're just presenting on 8 of the 14 in this PowerPoint presentation.
No, let me say that again.
Oh.
So of all of the ones that are listed on the previous slide, is this the totality of the indicators, the community indicators that as the county we're tracking over time, or is this a sample of, like, for instance, under affordability, are there really 20 indicators? It's just that we're just pulling 2. No, there are just 2 for affordability.
And they all stem from the upward mobility work.
Right.
Yes.
Yes, Chair, Commissioners. Yes, that's right. Thank you. And the total is 14. There were initially 3 for each of the areas. These are not the only things that we're tracking. These are the things that we're tracking as part of our community indicators program. We're tracking a number of things across the organization that aren't performance measures that we control in other areas too. These are the ones that came from the upward mobility process. And so they've been vetted with community directly, and they're the things that rose up amongst many. There likely were hundreds. I was a part of the planning process for that. And so it came down to these last 15, now 14, because we're working on one that doesn't have good data.
So just again, to frame the conversation for me, since these are new, so, if somebody wanted to just get an overall sense based on the themes that came from that community engagement project that said this represents, just kind of get a temperature check of how the community's doing year after year under these specific themes. This is a great dashboard for somebody to quickly get an easy to read, comprehensive view of how the community is doing based on these indicators. But the county, so for instance, if somebody were working in employment or housing or some other areas, they also are looking at other external community-based indicators that would inform their very specific work. It's just that that's different from this kind of overall umbrella dashboard that we're.
Chair, Commissioner, that's it exactly.
Okay, thank you.
Yes.
I just wanted to
Yes, that's a great way to
frame that in
characterize.
my head. Okay. Thank you for that.
If I may add, just for example, our housing stability team, right, we track our homeless population and where they are. It's just not here. It's just lives within the departments. Okay.
That's right, Chair, and that actually, and some of that would be more on the performance measurement realm than community indicator, but it's
Okay.
both. There's a continuum, and we don't draw a distinction necessarily. We are looking at a full continuum. So things we control, things we partly control, and things we really don't have direct control over at all. But they're important and things we can partner with.
Great, thank you.
So our first indicator under affordability is median household income in the previous 12 months, meaning that for each of the data points, half of households in the county had less income than this amount and half had more. This data comes from the US Census's American Community Survey 5-year estimates. So those are larger, more precise estimates based on samples from a 5-year period. In this case, a 2014 to 18 sample and a 2019 to 2023 sample. All the data in this chart is inflation adjusted to 2023 dollars so that they can be compared like for like. I do want to point out that the data points for specific race and ethnicity groups have pretty widely varying margins of error depending on the sample size. And so the American Indian sample in particular had a margin of error in 2018 of 26% and in 2023 of 44%. There's a couple others that are around 10%, while the rest are in a more normal range where you'd want to see them around 5% margins.
Question.
Commissioner
Question.
Moran, do you have a question?
Yes, can you share why the discrepancy is so high?
Chair, Commissioner, it's due to the size of the sample that the US Census Bureau was able to reach for the purposes of this survey, the American Community Survey.
So do mean the survey is low numbers from the Native American community? That's why. So you're not really capturing from a big enough
That's,
population, I guess.
that's correct, Commissioner. It's the population is small in
Mhm.
Ramsey County relative to the size of the county, and so the sample is small.
Mm-hmm.
So their efforts to get a representative sample are challenging.
Mm-hmm.
So it leads to high error rates in the sample.
And I want to add that that's the reason we use the 5-year data,
Mm-hmm.
because it brings in more
Mm-hmm.
numbers to hopefully try and reduce the margin of errors. Sometimes it's beneficial, sometimes they're still high.
Interesting, because you would think because it's smaller, you can capture a bigger population, but it's the opposite, huh?
Yeah, and part of it, Commissioners, they don't stratify their samples, so they're not like directly looking for, in this case, American Indian individuals to sample. So the survey is broad, community-wide, and that's why we see the sample numbers come up kind of similarly in terms of the percent of their population, but
Mhm.
that means we have higher rates.
Mm.
So it's not that sophisticated a sampling.
And to Lindsay's point, there are 1-year samples in every year that are published as well, and so that's the most recent data available, but there are also much smaller samples, and so it's a lot noisier with a lot larger margins in each given year.
Mhm.
Okay. Our second indicator, also under affordability, is severe rent burden, which is defined as households that spend more than half of their household income on rent. This indicator shows the share of households experiencing severe rent burden both below and above 200% of the federal poverty level, which was $55,500 for a family of 4 in 2022, which was the year of this data sample. So if a household had income at exactly that 200% level, spending more than half of it on rent means that their monthly rent was over $2,300, $2,313 per month. And 200% of federal poverty turns out to be a pretty meaningful benchmark for this indicator, and that very few households above 200% are severely rent burdened, while half of households below 200% are.
Commissioner Devon Singh.
Yeah, I was just, is this population of all households or households who are renting?
That's a good question. Yeah.
Rent, yeah, they rent, right.
This is of folks who are renting, so this is different than a cost burdened. Like,
No, that's
it
right.
doesn't include
Homeowners.
cost burdened homeowners,
That's right.
it's specifically renters.
So
Okay.
Chair Commissioner, that's correct. There's we have a household one too. That's not part of this process, but we do track that also. I should say home ownership. But this one is for rent.
Commissioner Moran.
You might have stated this earlier. Why is it that that the Asian community is not visible here?
This, I'm sorry, Chair Commissioner, this is the last one we have where the original data set did not include Asian, and we're trying to replicate the data set with some other source. And so in this, the Urban Institute does not typically include Asian as community experiencing disparities across the country. Ramsey County is unique, and in some ways in that regard, but we want to show disaggregated data across all communities where we can.
So this comes from the Urban Institute?
The-
Mm. Okay,
Chair and Commissioner, the original data set for this indicator came from the Urban Institute. They did not update it for this year, and so they pointed us to the National Equity Atlas. And it also relies on census data for the underlying data source, but it's published by the National Equity Atlas.
And I should acknowledge too that we use people of color here, not something that we use as an organization, but it's the way that the data was presented, and we wanted to acknowledge that here.
and one question, why are we citing the Urban Institute?
Commissioner, the Urban Institute was the organization that helped us originate the data set for upward mobility. And so that was the community engagement process around developing the set of indicators. And as we go year over year, we're moving away from the original source data and creating ways for us to be able to disaggregate what was created as part of that process. There's just a couple left that we don't have a clear line data source to be able to replicate.
And this started in what, 2018?
2020,
Oh, 2020?
2021 was the first year we had the full set to share.
I wanted to go back to real briefly to Commissioner Jevons' original question on renters versus homeowners. The Equity Atlas does publish this measure both for severe rent burden over 50% and rent burden over 30% of your income for both renters and homeowners. We are only publishing this one, which is severe rent burden for renters, because that's the measure that was chosen through community engagement. But we do have all four of those data points available from the Equity Atlas.
And so with the homeowners, it would just be, it'd be cost burden for the because it's their mortgages, right?
Correct.
And the reason, and so that's kind of one of the reasons I asked the question earlier about how our different departments use other community indicators that get more into the weeds. Because when we look at building intergenerational wealth and moving from rent to home ownership, we also don't want to move somebody from being overly rent burdened to overly mortgage burdened. If that's going to not lift their families up going forward, but only set them up for continued struggle. It's a mortgage versus a rent payment. That's still too much, right? So I appreciate that we have these sources complementary so that we're talking like to like.
Any other questions about this slide? Okay, thank you.
The third indicator today is under wealth creation, and that is the home ownership rate according to the American Community Survey. And the countywide rate was 59% in 2018 and 61% in 2023. And I'll just make the same note as previously about the widely varying margin of error according to the for each of the different subgroups.
Yep, Commissioner Jefferson.
I know this isn't part of these indicators. But I would be curious, and I know it would be from an outside data set and, would be the age of home ownership because of the markets have been such a challenging for younger folks. I mean, the age of home entry has been rising, which is an indicator of again, of kind of a frozen market. I'd be curious to see where we're at as a county is allowing people to enter into that market and how that's changed over time.
That's great. Right.
Thank you.
Mhm. Any other questions? Okay, next.
The next indicator under wealth creation is the denial rate for home purchase loan applications. Based on 2023 data from the Consumer Finance Protection Bureau, the Home Mortgage Disclosure Act requires most financial institutions to maintain, report, and publicly disclose loan level information about mortgages, including actions taken on home purchase loan applications. And this indicator had not been previously published due to some challenges with the data set and the way that they disaggregated. We removed loans purchased by another financial institution because that's not really an application outcome. And data on race and or ethnicity was not available for 20% of the remaining data set, either because borrowers chose not to share that information or because there were multiple borrowers and there's no way to code that for multiple borrowers for each transaction. And so that's what the race not available on the end refers to. And so the countywide home purchase loan denial rate in 2023 was 14%.
Commissioner Miller.
Do we know if these are any of like the programs that we offer for first time home buyers or for home buyers? Or I think of like American Indian, they have home programs like HUD 184 loans, right? So like who've applied and gone through that process and been denied, but you may not have access to that data because it's a HUD program, right? So is this just through, like you, I'm assuming just through the banks, not through like county programs, city programs, or other state programs?
Chair and Commissioner, the answer, correct. This data comes from from all the financial institutions
Okay.
that have to report to the Financial Protection Bureau.
Okay. Just thinking like Habitat for Humanity, the people that apply for the loan then get denied, right? And I wonder if that's included in this as well. I mean, might be, because they have to get financed through an institution, so it should be okay.
May
Thanks.
you verify that? Or just confirm that? Like.
I can look into that further. I don't know.
If you'll get an answer,
Well, it's more just that,
Report it.
yeah,
my supposition is that those would be included as part of this data set, because if there was a loan application submitted, it would be captured in this data set as a whole.
Okay. Okay.
So the next category is early childhood. And the next indicator is the number of childcare spaces available per 100 children under age 5. It shows the number of available childcare spaces at center-based childcare, licensed family childcare, and public childcare providers like Head Start and Pre-K within a 20-minute drive for every 100 children under age 5 in the county. And according to this data, Ramsey County currently ranks 78th out of Minnesota's 87 counties for overall childcare supply. This data was obtained from childcareaccess.org, which is a U of M research project. And it uses licensure data from the state's Department of Children, Youth, and Families, combined with census data to approximate that 20-minute driving distance. This is a new data source for this indicator, and it's a little bit more complex than what we had previously.
Commissioner Jefferson.
I know this, this is aggregating for all children under 5. Do we have any sense of, just like in the job market, there's the people who are working and not working, but not all of them are unemployed because not all of them are seeking work. Same thing here, like, do we have an indication of how many families are looking for care that are going without care versus folks who have, are either doing familiar care or other informal care, so they're not necessarily captured in this particular more formalized childcare market?
Chair and Commissioner, that's a really good question, and that's not captured from this data source. I don't think that's not, it's not something that they're surveying for in this source.
And Chair Commissioner, that is an example of something we're looking to get more information on though. So there's many of these present other questions that the community likely knows. And so that's why we go back and have those conversations.
May you go back a little bit just to explain the numbers here a little bit about what these represent? So for every 100 children under the age of 5 right now, for example, there are only 4 spots available in public programs in this moment.
Chair, correct, within a 20-minute drive of where those children under age 5 live. And that's using census data to approximate those locations for children under age 5, to then say, based on the licensure data of where there are these programs available, how many spots are available within that distance
Okay,
where folks are living.
okay. So can I, what, I'm just trying to figure out what this tells me too, in terms of, it means that our public programs are limited, licensed family child care centers are limited, but there are openings in child care centers settings. Any other questions?
Yeah, is that 20 minutes by car or total transportation time? I mean, because lots of folks, I'm curious, like, what is that 20 minutes? And the other reason I caveat this is that having lived in a rural area, suburban areas, and in urban areas, 20 minutes in a rural area is, you can pretty much circle what that mileage is. But 20 minutes in an urban area could just be around the corner in St. Paul, today.
Mhm.
So I'm just
Roseland.
curious, like, how do we gauge what that circle actually is?
Chair, Commissioner, it's a good question. It is a driving distance measurement. I can tell you that much. I don't know exactly how they calculated that using GIS. I would imagine that it is based on driving distance and not just a simple
Radius
mile
of 10
radius.
mile radius or
Exactly,
something.
correct.
And this is all just for Ramsey County?
This is Ramsey County.
Okay.
If you're interested in this measure, I would encourage you to go to childcareaccess.org and check out what they have. They do actually have this mapped, and so you can see geographically within the county what this looks like in terms of instead of disaggregation by race and ethnicity, disaggregation by geography.
Mhm.
That makes sense.
Yeah, I would be more interested in using this for, as we do planning around, our transit, right? About where people are trying to get to, for work, for healthcare, even childcare, things like that. And is this used in that planning process currently? Do you know?
Chair, I couldn't answer that question for the organization, but we will share it along.
Okay.
Madam
Oh,
Chair,
yep,
this is
Madam
something we
Director.
could maybe make sure we layer into our economic competitiveness inclusion plan.
Mhm.
And also, I think you remember we did some ARPA projects related to a childcare academy, and really the workforce issue was kind of a big key one. But I do think the difference between what's happening in urban city of St. Paul versus the rest of Ramsey County is pretty significant. I think if we ran this, if we could find a way to see this just for St. Paul, or even lower income neighborhoods, it would be a lot different than just the more aggregate Ramsey County. So definitely something for us to drill down more on it over time. So,
Okay.
yeah.
Is this a project that we could ask the U to do last week? We just
Oh, the
awarded.
transportation.
Yeah, the transportation research project with the U. I think.
I can follow up with
Ethan.
Ethan, yeah.
Yeah.
That's fine. I was thinking the same thing. Thank you. Thank you, but yes, I think in response to even the county manager Becker's comment about. I think we can mine into this with the partnership at the U and with our own connections.
Mhm.
Yeah.
Okay.
So they have the data source, so I
Yeah.
suspect that because they did the GIS work, they can mine into it for us on the other side.
Okay. Commissioner Jevon Singh.
Well, and I'd also think of, it's not that long ago, where, I mean, there's some of us here are still doing childcare, right? So I mean, it's not just where you live, but it's what center's closest to your other children's school, or what's closest to your workplace. I mean, so the idea of the center at home, I think there are multiple like home bases that people would be
Mhm.
looking for childcare as far as convenience and that I guess I'm curious that to be meaningful, I think that any one of those indicators could tell us a story.
Mhm.
And Trish, I will say that that's why this source is exciting to us, because it's local and they're looking at our data statewide, so we're gonna have more on this.
Excellent.
Thank you.
That's great.
So I'm going to turn it over to Lindsay Menard for the next two measures on the health.
Hello, good afternoon, Chair, Commissioners. The following two indicators focus on health outcomes. The first indicator is the percentage rate of births with low birth weight out of all births, disaggregated by race and ethnicity. A child born weighing less than 5 pounds, 8 ounces is considered to have a low birth weight by the CDC, Center for Disease Control and Prevention. The countywide low birth weight rate is 8%, while the state's is 7%. Low birth weight is an important public health indicator that can be used to assess maternal health, nutrition, healthcare delivery, and poverty. Infants born with low birth weight have approximately 20 times greater chance of dying than those with normal birth weight and are at an elevated risk for adverse health outcomes. I want to note that Commissioner Jevon Singh at the June 24th board meeting, you requested to see this data broken or disaggregated out by race and ethnicity, and I'm happy. And at the time, Larry indicated we'd be bringing it to you later this summer, and I'm happy to share the data with you today. The data is from the County Health Rankings and ROMAPS program, which is a program of the University of Wisconsin's Population Health Institute. Unfortunately, this will be the last year data will be available from them as the Robert Wood Johnson Foundation pulled the funding. So in future years, we will have to look to different data sources to be able to track and measure this indicator.
Commissioner Jevonsing?
So what, two questions. One is, thank you for that follow-up that lets us know that the questions that we're asking here are meaningful over time. I
Mhm.
really do appreciate that. But I will say that I went ahead and looked online just to see, well, okay, this is county-wide, but where is that? And so just, if I was reading the data sets right, in Minnesota or US, it was 8.6%. Was their median, and then the Minnesota was 7.2. So at 8%, Ramsey County is actually above our Minnesota average. Am I saying that right as far as outcomes? Is that and is that a positive or a negative?
We
Right.
are higher than the state rate.
Right, so that's,
It's a
yeah,
negative.
higher than the state rate and, but lower than the US.
Yeah.
Okay, and then I guess the question is with the data being, the funding being pulled, I'm guessing that this will, it's not only pulled locally, but pulled, is it a national data set? That's being pulled, or was it just local money that was pulled, you know?
Robert Wood is the national foundation, so County Road. The data set is used nationwide for counties, cities, states. And the funding's been pulled to support the continuation of this resource.
And I would guess that, given that, we're going to see more and more data sets experiencing that lack of support. And I think that just noting that, one of the benefits of a data set that's nationwide is so that we don't just have a number in the air and not know, is that good or is that bad? We have a sense of where is that within the context of the country, within the state, within our neighbors locally. And so I guess, just knowing that as you are looking for even more specific and disaggregated and more accurate and more helpful data sets, it will continue to be a challenge. I mean, I'm just saying, I understand, I mean, the road ahead for you is going to become even more challenging, because we're asking you for more specific data,
Mhm.
more useful data, when those data sets are going to be rare and not as supported over time. So we'll be as compassionate as we can going forward, knowing that that's a real struggle.
Thank you, Commissioner. Appreciate that.
Commissioner Miller?
Okay, you ready? So, okay, do we know if any of these birth rates, like what the contributing factor to the low birth rate is? Like, I think of like premature addiction, other health issues, or were they just born full term and they just otherwise healthy besides low birth rate? And then next part, do we know if they were insured, not insured, or received prenatal care, or just no care at all?
Thank you, Commissioner. So in the data set, they do state that the rate can be due to a variety of factors, premature birth rates being one of them, intrauterine growth restrictions, maternal stress, living in a neighborhood with a high level of pollution,
Oh, okay.
substance misuse during pregnancy, multiple births, preeclampsia, certain infections, like bacterial infections or sepsis. So there's a variety of reasons driving this indicator. There was no data provided on
Okay.
whether they were insured or not. I don't know if that data exists, but we can look to see if it's out there.
Okay, I think that, yeah, that'd be great. Thank you.
And I
Commissioner
think that's
Jefferson.
super interesting, are there any particular of those indicators that say, are there any one that are particular to Ramsey County that we may have some potential to push the needle on, is it
Mhm.
environmental factors, is it access to care?
Mhm.
Like where are some easy, not easy, but where are some obvious intervention points? If that data is provided, that's a really good question.
Thank you
But-
both, and that actually is another opportunity to, if we can hone in on that, reach out to particular parts of the community. Who could be helpful. in the
Well, I think
conversation.
that's more of like, I don't know if community health, I think it's more of a statistics.
Mhm.
It's more of a data question, right? And it makes sense in order for us to be able to respond to what we're seeing. We can't see it. And it's come from the county health rating, so it's health.
Mhm.
So it seems like they can drill it down to be,
Mhm.
more directly of what's happening here. What are we seeing, low birth rate because of whatever?
Thank you, Chair Commissioner. I think one thing that, not to belabor the point on this particular data source has been around for some time. And they're really sophisticated and they've been a fantastic resource. So I think for us, it's
Yeah,
that
okay.
plus trying to figure out and and find what's next.
Mhm,
If not
mhm.
the current source, what else can we discover that can do that?
Yeah, because we need to tell a story here. We can't just say, oh.
Oh, Commissioner Miller first.
Well, I was just wondering, because we have a program, don't we, about low birth rate
Mhm.
and, if that program is telling us that they're making headway at improving this number, but we're seeing this data and it doesn't look like it, I guess I'm just, which one do we go with? Or which one's more accurate? Does that make sense? I mean, wasn't there just a documentary that we just published on the, right?
The Beck group.
Yeah,
And then what is this?
Ramsey County Public Health has been doing some specific work around birth equity and health disparities.
Mhm.
Oh,
that's
the
a good-
mothers first.
And
Are you
there's
talking
a
about-
number of different programs, but so I guess the question is. How do we get close enough into the data to see where we're improving and
where we're not, yes.
Mhm.
Thank you for capturing.
Yeah, yeah.
Right.
One of the questions I had is, with the funding being pulled on this, has been identified as a fairly sophisticated data set that allows us to do some of this nuance, is there any way, do we have any indication if the existing data sets will remain there for research, or if they'll be unsupported and going away? And the reason I ask that is because I know there have been other data sets where it's not just they're not supporting future research, they're just literally pulling the data down. Do we know if this will still be available for some of those questions that we asked?
Commissioner, thank you. From what I've read at this point, yes, they're actively working on a way to make the data be available in future years. Whether or not they're able to find a way to do that is, I think, yet to be determined. But I know the folks at the Wisconsin Population Health Institute really value the work and the data set and are hopeful that they can figure out a way to archive it. And I do think they're working on securing funding to keep this going.
Who is
well,
them?
The Wisconsin Population Health Institute is trying to figure out a way to fund this project to keep it moving
So we're
forward.
using Wisconsin.
That's where the county health rankings comes from. They manage that data set.
Much like the previous one at the University of Minnesota, the
Mhm.
University of Wisconsin's had a longstanding relationship with Robert Wood Johnson to do this work.
But it seems like Ramsey County will have this data. Somewhere in the state of Minnesota, we have the data that can show those birth rates here in Chicago and by the 87 counties. To me, it seems like we collect data locally
I think
for the
there,
state.
Commissioner, thank you. I do, when we submitted the performance measure data in June, at the end of June, I believe,
Mhm.
there was a state data set we used. I don't know if they're able to disaggregate like county health
I think we
rankings
do.
is.
For some reason, I'm thinking we have all this here locally.
Great, that would be great if we do.
Yeah, Commissioner
Yes,
Moran,
yes,
that reminded me of, I know that I received some presentation at SHAG, like at a,
Mhm.
that Chief Maria Saravia attended with myself about 2 years ago, where they
Mhm.
presented that the state did invest in infrastructure for like,
The collection of.
yeah,
Notice.
collection of like data like
Mhm.
this. And that a lot of the, both like the hospitals or health insurance, like collaborated together
Absolutely.
to be able to figure out how to like get data like this together. Yeah, so any updates on that would be great too.
Mhm.
Yeah, for us to get, would be appreciated. Okay,
Thank you.
thank you.
The next indicator we're going to take a look at is the rate of preventable hospitalization stays per 100,000 Medicare enrollees. Patients were often hospitalized for conditions that could have been treated in an outpatient setting, such as congestive heart failure, bacterial pneumonia, urinary tract infections, which suggests that the quality outpatient care was not accessible. This measure may also represent a tendency to overuse emergency rooms and urgent care as the main source of care. Preventable hospital stays are are costly, disproportionately impact historically marginalized communities, and can lead to long-term health and financial consequences. In 2022, the countywide rate was 2,270 preventable hospital stays per 100,000 Medicare enrollees, while the state's rate was 2,255 preventable hospital stays per 100,000 Medicare enrollees. We do believe the 2022 data point for American Indians or Alaska Natives is a data entry error. We are looking further into this data to verify the rate, and we've reached out directly to the county health rankings team to dig further into this discrepancy that we believe exists.
Commissioner Jevon Singh.
When the numbers drop, from 20, when we see a number drop from one year to the other for any one of the groups. I think you captured a couple of different ways that it could be reflecting that. I guess one is it's a decrease in access to hospital care. Is it decrease in access to Medicare access or increase in, I mean, I guess there's like a number of different things that could cause it, right? If somebody has an increase in access to preventative care, that would keep them away. Or if they just, even if they would have chosen to go to the emergency room or go to a hospital stay, but somehow they were unable to, or weren't admitted. I guess, do we have a sense of what's behind these numbers more specifically?
Not, Commissioner, thank you. At this time, no, we can go back to the data source and see if it's available. The data is being directly pulled from the Center of Medicare, CMS, which manages all the Medicare claims. So we can go and look at the primary source. It is, will take a little bit to understand how to query, but we could see if it's available. Other than generally speaking, as to what was mentioned earlier, I think it might be difficult to pinpoint.
The other piece that I'm nervous about is the idea of if this is 100,000 for Medicare enrollees, what's going to happen when the number of Medicare enrollees drops due to shifts in policies? We're still going to have preventable hospital stays, but they might not necessarily be captured in Medicare enrollees. So what is this gonna, I mean, is this gonna be? Obviously, we're gonna have to, if we do have a drop in Medicare enrollees within Minnesota or within Ramsey County, we're gonna have to somehow account for what that looks like, right? Because that's gonna be a different population of people. I don't know, I'm just, sorry, my brain is breaking with all this questions.
Commissioner Miller and then Commissioner Moran.
Do we know if this is duplicated or unduplicated? Does that make sense? Or is one person being counted as one visit even though they've had multiple, or is it also, I'm at the hospital, but I have 6 different things wrong with me that's contributing to my stay, so now they're counting that?
Commissioner, thank you. So the rate is determined by taking the number of discharges for ambulatory care sensitive conditions and dividing by the number of Medicare beneficiaries, ages 18 and older, continuously enrolled in Medicare fee-for-service Part A. And so I would assume duplication is in there.
Okay. Fair, Commissioner Miller, it would be duplicated where someone is discharged multiple times.
Okay.
So like
If you
the
discharge
scenario
for the
where-
same thing with 6 different ones, it's gonna be counted as once.
That's right.
Okay.
So if you're in once and you get discharged for the 6 things at the same time, it would be one.
And it's also helpful that you said that for continuous of care, because oftentimes we see a lapse in coverage and then we see, or I would assume you see increase in hospital stays or doctor visits because they finally have coverage. So that's helpful to know as well, that it's just continuous care. Okay.
Any other questions? Oh, Commissioner Jevon Singh.
Oh, just again, so I know the way you described how they were getting at this number, though, seemed very not disaggregated out, meaning it was the population of people who were enrolled divided by the number of hospital discharges. So it's not tracking any individual person at all. It's really
Mm.
just saying how many people have gone through the door
Mhm.
versus how many people are enrolled. So it's a
Mhm.
pretty, you
Error.
know, it's a, yeah, it's a
Yeah.
pretty
Yeah.
big kind of calculation. It's not at all tracking some in an individual's specific eligibility or ineligibility and how that ties to their decision-making on hospitalization or not. It's a pretty high scale kind of, okay.
Exactly.
Commissioner Moran.
So I'm trying to understand the preventable hospital stays per 100,000 Medicare enrollees for the American Indians and Alaskan Natives. Right, 100,000. We know that number has been like lower because they're hard to track.
Yeah.
But from 2758 to 675. I don't know, that seems pretty incredible to see in 2 years a dip like that. But at the same time, we have the low birth rate that has increased. And I don't know, I'm just like trying to like read this and understand what's happening here. Without feeling like we're putting well.
Commissioner, thank you for the question.
Mhm,
We think it's a data entry error.
mhm,
And so we have reached out to county health rankings to further dig into
Mhm.
that data point specifically. My guess is it's missing a two, but I can't, so it would be 2,675,
Mhm.
but total assumption
Mhm.
guess. But when we saw the dip,
Yeah.
we thought the same thing as you, something is
Mhm.
not aligning with the data.
Okay. No, we'll bring it back though.
Chair, Commissioner, like, Lindsay said, we are actively trying to find the answer to why that, and it may be that it's correct, and if it is, we need to understand why. So there's still a why
What's the story
question,
there? Mhm.
whether it's an error or it's correct.
Commissioner McGuire.
Thank you, Madam Chair. Just speaking of data entry and all of these things, with our with our data entry and our computer systems getting a little more sophisticated, if we can pay for them, where we hear about AI, actually doing some work faster and everything. Are we expecting that any of these numbers would be disaggregated faster, or that our numbers will start to reflect more accurately the kind of the nuances that might be seen, like we just talked about discharges of the same person, there might be a person in there for different things. Just any of that. Do we expect that any of this tabulating of numbers, these community indicators is gonna get a little more precise, or do we have any sense of that? And I don't know how AI works all the time. I'm not quite sure, but I've heard it's supposed to be helpful in a lot of areas, so.
Chair, Commissioner, I think there's a number of directions to take that question. I will
Yes,
say,
just however you
just from
feel like,
someone
right.
in the research community, yes, there are opportunities, but where the challenge lies is where we already have missing data, we have people's reluctance to share, and there's a number of different factors. Where I think we're not sophisticated enough on that front is to model something that will replace real people. In term, not in just the doing, but at least it may be out there, and certainly we're open if there are opportunities to do this better. I think that's the risk, though, is we're going backwards in terms of source data, access to source data, and that's the risk
That's
here.
the real.
So if we're feeding AI less information, then we're not likely to get something better as a result.
Yeah.
That's my perspective today as we sit, but
No,
it will evolve.
It's good to
So-
keep that in mind. I keep thinking we're gonna get better, but you're right. The data going in is getting
No,
less because people are less willing to share. And any other things? Why is, I understand that data going in is maybe less,
Mhm.
but is it because of people's unwillingness, or what are those reasons?
It's the risk of what your data is being used for, perception, not, just in terms of sharing. We've had some conversation about this and previous focus groups. This is not,
Yeah.
it's not new. It's been coming on for several years. So I think the risk now is as information is shared, in ways that it wasn't intended, that tends to lead to, my own personal take is I'm reluctant to give certain institutions information, so. And I think that that's the risk is we need to be
So-
honest about how we're using people's information. So that's where we come in.
So, because we're doing so much of our decision making based on community indicators, we're having workshops on it and everything, we just have to. Appreciate that the data is what is the best that we can do at this point and use it the best we can, but knowing that it's obviously not a perfect.
Yeah. And I will say one last thing, and then Dave wanted to add something. The tools are getting better. So as the tools evolve and get better, the data, that's where we're trying to make sure that the data keeps up.
I just wanted to add, and this speaks to the source of this data, county health rankings potentially going away. We rely on the underlying data sets as well as on the organizations that are able to crunch those numbers and then publish this data reliably and consistently. And we're looking for that data that's county specific to Ramsey County. So we're talking about our community and disaggregated by race and ethnicity, because that's important to us. And it's that is challenging to find data that is specific to our county and disaggregated and reliable and consistent over time.
I'm thinking, and like at the state level, in order to like move a bill that's intentionally focus on low birth rate, we collect the data. It tells us where we see low birth rates and things like that. And I just can't understand that. I know you're gonna check on this, that this data is here in the state, right? That we can see to help us pitch us. 'Cause this is really is about what we're gonna do as a county, and where should we focus our dollars or supports and things like that, as requested per community. Right, and this is a response to that. I do really believe we can get better data than what we have here, more complete data than what we have here. If it's not DHS or Department of Health, and then they can break it down county by county and what that looks like. So I'm really trying to understand the population for juvenile justice arrest. We're not there yet, but I'm trying to understand it. When we can.
Yeah.
That,
I think that's a great segue. We'll turn it over to David.
that is the last indicator today under public safety, and that is juvenile arrests. This slide shows the 2023 youth population in the top box. And then below that, the number of arrests of people aged 10 to 17 for any crime as reported by local police departments, broken out by race, to show the share of juvenile justice arrests by race as compared to their share of the county's youth population by race for 2023 going back to 2019. And note that the data reports the number of arrests, not the number of people in each year. So people can be arrested multiple times. And so it does have duplication in that respect.
So the age of the group in that top bar is 10 to 17.
Commissioner, correct.
Maybe we can disaggregate this a little bit more. How many 10-year-olds, how many 12,
By
I mean, so, by age.
I have a 10-year-old daughter. Imagine
Yeah.
her being arrested.
Really?
Yeah.
Any other questions about this? Thank you.
So that's all of the indicators that we're presenting today. And in terms of just some of the key takeaways that we've touched on already in this presentation, clearly racial disparities persist across our community indicators, and continued intentional policy and investment in racially and ethnically diverse communities is needed long-term. Two, we as Ramsey County government can't move the needle alone on these indicators. We really rely on the work of our partner organizations to make a significant impact on these measures. And then, as we've just talked about a lot, some of this indicator data, some of these sources are unstable, and they might not be available in the same way in the future, and others are inconsistent in their disaggregation. And so that's something that we need to continue to look into and work on to try to get the best data sources we can over time. And finally, as we noted at the beginning, this is just one of the many ways that we measure our work and the overall health of the community to help inform the county's budget and strategic planning.
And Chair Commissioners, that is a live link in your packet. So you should be able to access the open data portal directly from that link. So next steps. Oh, sorry, Commissioners.
So we talked about these data sets and some of the vulnerabilities of them being cited that are at risk. I mean, to maybe sit a little bit on the policy advocate side, is there any, on this dashboard, is there any kind of like red flag that says this, you know, there's a, this basically says this data set is vulnerable to continuity. I mean, it's one of those, I mean, I'm just thinking of and I don't know where we lay, and I might be getting into territory there where we do that extrapolatory kind of narrative ourselves as we push for this, but if community members, if our broader network of providers, if other organizations and decision makers within are looking at these data indicators, I think it's important for folks to know, you know, they have a little warning light to say, and we may not be able to track this going forward, given the data sets may no longer be here, or to some way to indicate, I mean, there are, I mean, just like these indicators are somewhat we are one of many actors who try to impact, for better or for worse, these community indicators. But there are a lot of things outside of our control, and one of them is just the availability to continue to track this, right? I'm just wondering, and I'm curious to see, there are lots of different policy entities that rely on lots of different data sets that are facing these challenges. Is somebody already doing such a kind of a warning, we're concerned this might not be here anymore, to let consumers out in the world who aren't tracking this to know how all the different ways this intersects in our work? I'm just curious.
I think the Chair Commissioner Jim saying that we're trying to acknowledge where we know there are risks and the own data that we collect, and where we look, which is more broadly than these particular indicators too. As far as like an orchestrated effort to do that, I'm not sure that I think it's the research and policy community broadly, and all of us know the risk that is before us if we lose access. We know, as an example, the census data is the core for so much of what we try to use as the base, and a lot of other things are connected to it. That's where we get our ability to disaggregate across populations. And, you know, I think right now we're in a position where we expect that we'll always have access to at least what we've had before, but we know right now that parts of that data set is not available in the way that it's been previously. So
Are there research or advocacy or membership organizations that, you know, that are tracking this? Just like, you know, we're tracking dollars that are impacting the work that's coming in Ramsey County. Is there a particular association or academic or data group that, you know, is also kind of tracking how this is impacting your sector, so that if we're wanting to get I mean, and I say this as a way of contextualizing how we do data-driven work going forward in this unstable time, and also not wanting to be hyperbolic. Like, I would actually want to know, you know, what data sets have actually already been cut, which ones are we concerned about, or, you know, what is just, you know, inflammatory headlines, you know, and we really shouldn't be so concerned because, you know, actually a lot of this is, you know, funded through universities or other funding sources that are committed to continuing the work. It's hard to cut through the static, and I was just wondering if you had a source that you all look to, so you have a sense of what's real and what's just noise.
Can I ask a question, Madam Chair, before we do that? I wonder if like maybe we went down a broader set of indicators with the Urban Institute than maybe like sticking with, like I'm thinking Minnesota Compass or the Met Council, or like things that we know just are always gonna be there, you know? I think like, I don't know, I was just looking at Dakota County, Hennepin County, they just kind of lean on those kind of pillars of data. And then it's less about trying to match the data up, and then the work is really around the interpretation and kind of our role in the ecosystem instead of, we spend a lot of time just trying to find, you guys probably spent an exorbitant amount of time trying to find all the pieces of data that was there or missing potentially. So I wonder if maybe it's an opportunity to reset if we're not in this partnership with Urban Institute anymore. And to really think about, I know Wilder has a lot of data, that is Minnesota Compass, right? Are they
Yeah.
the same?
Yeah.
Okay, and then American, the Met Council for sure has a lot of data. So just a thought,
That
what
was
are-
actually, like, that was my actual follow-up question.
Yeah.
Like, is we have community assessments and other
Yeah,
indicators
yeah.
through Wilder, U of M,
Yeah.
so Children's Defense Fund, I mean, other groups that are doing this work, and even if they aren't these specific indicators that were pulled back from the day, is it time just to work with what we've got? I'm right there with you. I'm curious.
Might be less work, honestly.
Yeah, it's actually, it's a good segue to our next steps.
Yeah.
But we agree with the sentiment. I will say there are, those are some great sources, and they've been longstanding in the community. The Med Council is the host the Twin Cities Research Group as an example. And they have roundtables, they have lunch and learns related. There are national organizations that we're all connected to in some way. I think, to Commissioner Jevon Singh's point, that's exactly what what we know of, right, is happening right now in this broader ecosystem. There's a lot of chatter, there's a lot of fear, but there's also still a lot of data, and most things are still available. I shouldn't say still, most things are available, and new sources are coming online. That's what we're looking for coming into this, is we want the best sources, not the ones that were initially part of this process.
Yeah.
So it's likely, and I'll turn to next steps if you'll.
Yep.
So this year, we're looking to re-engage with community, later in 2026, I should say,
Yeah.
and our key stakeholders. And this will be an opportunity to go back and to look at this set of 14. It's still 15, but one that we really don't have good data for already. And make sure that we're still aligned with what is the most appropriate set of community indicators. And the next step, really, where are we at? Can we replicate these for consistency and sustainability? Many of these are already available other places, but not all. And they look at them often differently. As Dave said, we're trying to mine in, we're trying to understand what's happening in a disaggregated way across different ways of looking at the data. We may be able to do that with partnerships too, and not have to do it all on our own. And I wanted to highlight too, performance measures, as I said earlier at the outset, they're all updated already. And it was a big effort behind the scenes with a lot going on in the organization. Kudos to all the performance measurement action team members, departments, Lindsay, who learned a lot of new things to pull it off since Jan 6. So excited about that too. But all of this is part of our learning as an organization. We use data to do the big things, to understand what's going on. So I appreciate your questions today. The ones that we weren't able to answer, we'll come back and we'll give you answers. If they're not complete answers, we'll continue to work through it. So we're currently working on another set that's really a base level set of community profile, the highest level census data, because the quick facts is not available right now. So we're gonna put that out there. It's not a heavy lift for us, but just to have that for a level set for the organization. So that's one example of where we're trying to adjust, where data may not be where it used to be, and it likely will be at some point again, we hope, but we don't know that.
Commissioner Moran,
Yeah.
and then County Manager Becker, and then Commissioner Jevons.
So, thanks for the presentation. We look forward to, some of the responses to the questions. But can you also share with me the decision to focus on the 8 indicators out of the 14 that you, focus on? And I also would like, the number of childcare spaces available is important, but I think I also would like to know the preschool enrollment, who's enrolled by race and ethnicity and age, and maybe stuff like that, because for me, it's like educational outcomes, right? And so who's getting that early learning experience? Because we have huge deficit, with the low income community. But if they're not getting these spaces, it's something we need to think about in there. But how did you focus on the 8 out of the 14?
Yes, thank you, Commissioner. Part of it is that this is the first time we've done this as a workshop, since the first time, I should say, since it was a brand new set of indicators with the Urban Institute. Previously, we'd done this as a lead into the county manager's budget presentation. And so we had more time. We knew there'd be good dialogue. We also knew that the likelihood to get through all of them was not, we would probably not have enough time. That's a large part of it. The selection was really, we're highlighting the ones that we've made changes to mostly, the ones that we're improving. Some of the other ones are had already either previously had disaggregated data, or in the case of at least one of them, we're still working to figure out a best way forward. So it wasn't picking one over another. In some cases too, it's ones we present differently each time. So previously, I think the last time we presented on 5 indicators, and this time we did 8. But we can certainly do them all, or we can do that in a different way. So
Preschool enrollment, I really would like to hear what that looks like, by income and race.
Yeah,
Manager
thank
Becker.
you, Madam Chair. I was just gonna circle back to some of the next steps. Like, I think it's great that the government relations team's in the room. I'm grateful that, you know, Maria's here as well, because I think one of the things I'd like, and the commissioners, because honestly, one of the big things I would like to see us advance with, once we refresh some of these community indicators, is to be the leading I guess, source. Not so much in that all the data is from us, but to be able to speak on behalf of our community to others about what's going on in the community, recognizing that we've been really emphasizing that we can't go into every fire. We're not the only ones responsible for everything, but we can actually be very thoughtful in how we share information about what's going on in the community, whether it's to legislators, to our cities, to philanthropy. Like, having a good story here as to how it weaves into Ramsey County and the state of Ramsey County. I think that's something that the commissioners can be doing, you know, especially year round, but certainly on your off time when you're not the legislature, really being able to have, you know, 3 or 4 of these, like, you know, kind of having a mix and match. If we have 10 of these or 12 of these slides, like, you can pull a couple and bring them along with you as you talk to certain groups to say, we understand the community in terms of how they're dealing with this. We influence it in this way, but this is the bigger picture, you know. I think it's really important as we see shifts in funding and different roles and responsibilities, that we're really clear about, we actually aren't responsible for all the health and well-being of everybody in the community, but we play a big part in this. But the bigger picture is this, and there's these gaps, and how do you sit across the table from those people to talk about how they advocate for the other gaps that are there, that we are not necessarily responsible or have the ability to so directly influence. You know, we do very little actually when it comes to young children, when it comes to like their education, but we do a lot of the family stability. And so how do you use indicators to like lean into that, you know? So I look forward to maybe advancing that idea further, and this being kind of a part of it. Like, would be great every legislative session before we kick off, especially on a policy year, like for some of you to talk to the legislators about some of these indicators. Like, that would show some understanding of like, here's where we're coming from when we look at the bigger picture. This is how you fund us in terms of these ways, but that doesn't actually solve the bigger issue. So, yeah.
Commissioner Jevison, and then
I
White.
really appreciate that sense of us being able to use this beyond our own internal, like how we do in rubric every quarter or something. To as a narrative. And one of the questions that I had in looking at your number 1 on the next step, the idea of engaging the community, and also the idea of how we create some kind of a narrative, a collective narrative to be able to describe the county to all the different entities, I guess would be, how are we, so this is twofold. How are we partnering or using local data sets and folks that are collecting data? We've just discussed some of them already. To make sure that we're using data sets that are already being created and lifting them up and sharing those up, and also getting a sense of, you know, what is being used more in alignment with our other intergovernmental partners. And what I mean by that, are there any specific mandated data that we are being compared against for certain state funding or mandates or service areas that are direct? Like, are there specific things that we're already having to demonstrate to, either as a community measure to demonstrate need, or as a performance measure as a sense of accountability to tasks? Like, what are already we're obligated to use, or what's in alignment with the data that our other entities are looking for. But then also, what are we doing to consistently, I think this is an extension of what the county manager was talking about. How are we being responsible to then taking whatever those data sets are, whether they're these community indicators, whether there are performance indicators, whether they are like a community needs assessment done by one of our community partners, to then make that meaningful to our community members who aren't data geeks. How are we making sure to relate the work that we're doing, the needs of our community, in a way that's relatable to the individuals in our community that we either want to raise their awareness of this thing that you were experiencing in your family's life is being experienced by many, many of your neighbors. And here is a door you can walk through that may help you with that, because it's such a common occurrence that we've created a whole thing to like address it. Or this organization had created a whole thing to address it, not us. So I guess I know that's a bigger thing, but as we are looking at county responsible services, that means what are not county responsible services. And so I do like the idea of us being able to take on a more active role of what is it that the county could specifically do to create that narrative and to support the greater ecosystem, and then be able to relate that to the individuals within our community to be able to figure out how to navigate that. That's a lot of ideas all rolled into one, but it's just to say how very important this work is, and I appreciate what you've kind of elicited from us today from what could be really boring data. You know, obviously it's encouraging the work that we do.
Commissioner McGuire.
Thank you, Madam Chair, and just thank you again. Yes, this data is really important, and as we noted, also has its limitations in many ways, and we all want to get the most data, the most helpful data, that we can. I just wanted to say that it's no surprise that I think counties around the state are feeling this way. I said we just had our AMC, Association of Minnesota Counties Strategic Planning Session last weekend. One of the different outcomes that came out from what we've been moving forward on is that we actually want to be more of a producer of data, or we don't want to just disseminate information. We actually want to create appropriate information, meaning, we need information that's specific to each of our counties. So it's kind of goes along with what you're saying, that to look at all of these indicators and to find places where we can get better data that we really need. And, I'm just saying that as we look for our partnerships and our, that there are other other counties, and AMC is one of them, that are going to be doing the same thing we're doing, that we're looking for this. So maybe legislatively, we get the legislator to help with some of this, because, they're limited in all their abilities right now too, but this is going to help everyone, to get the right data, to get the right indicators in information that we can collect. So I'm just adding more brainstorming and more partnerships and just more thinking about all of this, and we're not really in it alone. And just affirming that this is really important. Whatever we can do to help with that, we're here for.
Any other comments or questions?
Thank you for a great job.
Thank you.
Yeah, really.
The other one I have, is just, for the, and county manager, I think, this is a great time for us to think about the spaces that we're all in, like the different boards and commissions that we're on. That they're always like in needing deeper partnerships. They're all paying for their own community indicators,
right.
like
Just-
reports or trying
I
to pull
know,
data
I
that
know.
may also be repetitive. So, the other ones I'm thinking about are our collaboratives, right? Our
Right.
children's
Mhm.
collaborative,
CAP.
CAPRW, yeah,
CAPRW.
and they're a huge agency and a huge partner that we are all deeply connected with, and we serve on the boards on too. So I think as you create this with about the community and regional partnerships, connecting with all those organizations that we already serve on as board appointments would be very helpful.
And Madam Chair, while you're
Yeah.
saying that, it just occurs to me that I've been committed to doing this at every meeting I can, and I'm not doing it, but, you know, the University of Minnesota, and I hope we're talking to them.
Oh,
They have tons of research projects going on.
Yeah.
I just did a bunch at the fair, you know, they have their university building. It's so great. If you haven't been there, I'm gonna say, go to the University Research Building and take their surveys, cause they're surveying everybody. You get a cute little sling pack now.
Mhm.
Anyway, the university's producing tons of information, and it's been a beef of mine since the legislature. They don't always connect with the policymakers. They do all this really great stuff. And then the connection with the people that are making decisions is not as
Fair.
strong as it needs to be.
Yeah.
So I'm just thinking, we need to be really deliberate in getting them to do that. Like, they're just so busy doing all their stuff. And they should be connecting with us, but I don't know that they always are. So I'm just putting it out there that we, in every way we can, let's be really deliberate about connecting with the University of Minnesota and all of our educational institutions, you know, so.
Yeah.
I'm-
I opened up a can.
Thank you,
idea.
thank you.
Commissioner Miller and then Commissioner Jevon Singh.
Okay, I just wanna quickly say, I know you guys already do, because I was a former contractor, but maybe even making sure that our contractors, the data that we collect from them or that they collect, or we ask for some of them on some of the grants we put out or the RFPs could align with our community indicators. Like, I know the hub work we did with Urban
Yeah.
Institute alongside the county did a lot of crosswalk work with these indicators for the American Indian community. So I know a lot of what the data that DIW is collecting is the data that the county needs to more accurately represent the Native
Right.
community on these numbers, because we realize how much of an error there is. So just, I mean, it's great. So thank you.
Commissioner
Well,
Jevon
it's
Singh.
almost like we set that up. I guess my other question was, you know, here as we're talking about how all the different organizations are doing their own community needs assessments and how there's all this data back and forth. You know, I guess I would be curious, and County Manager Becker, maybe you would have a better idea as we have a sense of the RFPs and the other grants that we throw into community and all
Mhm.
different walks of life.
Mhm.
You know, when we are asking folks either on their applications or in their reports back to us, you know, are we being really mindful about the indicators that we're asking them to share, that they're easily accessible so that we're not asking them to do extra data collection? I mean, they're doing data collection on the accountability of their performance measures.
Yeah.
That's different than as you're applying, demonstrate your neighborhood has this need.
Yeah.
It's like, well, for the county, if we don't know their zip code, that's on us. I'm wondering, how are we making sure that we aren't in the way, if we're not letting data and the data collections and the challenges around data collections get in the way of our own interactions with our other organizations.
Yeah, Madam Chair and Commissioner, I've seen less RFPs that ask those type of things. I will say they're generally, we've moved toward more open-ended. You know, talk to us about your organization, how you do the work, how you're gonna achieve the outcomes. But we can check that. I think on the flip side, where, you know, we heard about the grants office, I actually think where we could be really helpful is like making sure we share the right level of data so that people can leverage that, so they don't have to find it for when they apply to other grants, like with the federal government or state agencies. So I think less so a problem probably for them applying with us, I would think, from what I've seen, but definitely if they're applying to other outside entities, that might be more of a thing they might need.
And
You
then,
know.
if we are, I guess the other idea of being as we've talked about broader
Mhm.
ecosystem development, support and strength for things that we ourselves aren't doing, but we want to lift up as our partner organizations. I mean, the idea of having, a repository that's easy to
Yeah,
access and that we're sharing with all of our collective organizations, as Commissioner Jean had said, so that they know
Yeah.
when you're applying for grants outside,
Mhm.
the county on this website has a
Yep.
great list of
Yep.
community indicators to help your grant writers
Yeah.
fill out these
Mhm,
forms, so you
mhm.
don't lose a week trying to
Mhm.
be a researcher yourself.
Mhm.
You should be able to get a community
Yeah, no,
profile pretty
perfect.
clearly.
And even just like the state of Ramsey County, like what is
Mhm.
all those demographic information, like, but that shouldn't be rewritten 100 times, you know, like we know what that is. And
Yeah.
I was thinking one great way to have this conversation is, Maria and her, and is working, you know, I had mentioned with the federal response, we wanted to convene our nonprofits together. So we are actually gonna do that in November. And so I think that could be a place where we could at least have a quick touch point as part of that conversation, that this is a thing that we can all work on together, because actually get all those people in the room, you know, the county isn't here to with, you know, money on trees. We're actually here with other ideas of how
Yeah.
we can work together differently to advance, you know, the work. So this is seems like a lower cost thing that can help a lot of people that we can bring into a room to coordinate and align and support, rather than, oh, we have, you know, millions of dollars of money to fill all your gaps, you know, which we don't. So, yeah.
Well, and hopefully that is mutually beneficial and
Mhm.
reciprocal, so that, like, we have questions on childcare. Well, there may be a niche of an organization that's been collecting stuff locally that would have you know, a much more greater on the ground depth of information that we would find that would be adding to our thing that we're not gonna find in our global data set look, but having that added in would add a nuance to somebody's community
Mhm.
needs assessment. Yeah, okay,
Yeah.
there's some room there.
Yep, for sure.
There were so many good ideas. And,
Yeah, you summarize all that.
Yeah.
I will do my best, so I'm going to save this and then please add on with what I forget, all right? So big themes is about leveraging local organizations for data, including our colleges, the U of M, Wilder, for our next set of data. Leveraging organizational partnerships and collaboratives to identify future community indicators moving forward. And further data disaggregation on low birth rates, especially for Native American or yeah, for that one. And also further disaggregating for juvenile detentions by age, which was what was important. And then also some updates from Shack about that collection of the data sets for low birth rates, an update on that. What else am I forgetting? I know I'm forgetting some things.
Childcare, the early learning piece.
Childcare data,
Yes.
okay. For data.
So we want to disaggregate that by income and race, who has access to.
Access to childcare.
Oh, so access to, so that's more of the access to childcare. Anything else? Did a great job.
No, right?
Really?
Yeah.
Okay, all right, done good. Thank you so much for all this. This is all really good.
Thank you.
And really great
Thank you,
conversation.
guys.
Thank you so much.
Yeah,
Yeah,
good
you all have
job.
great questions.
It's a tough department, all the data people and all this data, what do you say, call